Everyone. Today is a special day for me because I'm starting a very new program on postpartum talks with various resources, with various uh, manpowers around the world who are working in the sector of health in a wide range, exploring the traditional methods and also the integrated new approaches. Today, I have a very special friend of mine, Anamaria Pontes from Brazil. And today we'll be talking a lot about the practices of postpartum techniques, postpartum care techniques in Brazil. And also, we will be revolving around her own experiences, whereby I have to introduce Anamaria first. I was so excited to start a program that I forgot to introduce her first. Anamaria is a certified dietitian and she holds a master degree in nutrition. She is right now combining the functional nutrition on her daily practices with her clients, and also most importantly, she has managed to treat her own endometriosis with the functional nutrition and also herbs supplements. And she has traveled India years ago, and she is also a well-known Ayurvedic therapist in her area. Welcome, Anamaria, to the show, The Vedic Couple. And we are in the season 1 and episode 1 of the postpartum talks globally.
Great. Thank you so much. It is a pleasure to be here, Sabdra, and I'm really excited for today's talk.
Thank you. Thank you. Welcome once again. I think without any further delay, Anamaria, I have to, and my audience have to know about your own journey, how you managed your endometriosis with all the knowledge you gained all around the world.
Great. Yes. So it's a big journey, and I suffered a lot of years without getting a diagnosis. And it was a very specific pain in my belly button. And on that specific day was of my period, it was just one day before getting my period. I would have really uncomfortable pain to the point that I could not go and do yoga or, my everyday activities. I wanted to be home. I didn't want to work, and I could understand what the pain meant. So that time I was living in New York City as already working as a nutritionist, and recommendations were just to go on the pills, without a break. So we usually, females, we take the pill for, 21 days, and then we break it to have our cycle. And that didn't feel right to me, but I couldn't take the pain anymore. So I went for 4 months straight on the pills, and I felt horrible. And I was like, I'm not even recognizing myself. I gained weight, the pain was still there. Mind you, it was just once a month, but it was enough not to understand that it wasn't okay. So it was a point that I went off from the birth control pills, and I was continuing my studies. And then it came time for me to go to India. It was my first time in India, 2013, and I went to the south, Tamil Nadu, to the state of Tamil Nadu, the city of Kannur. And I was studying firsthand in a Gurukula style with Dr. Sundara Raman.
Yes.
And now he has founded his own clinic. So it's called Mountaintop Clinic.
Yeah.
But at the time he was working at a different clinic. But it was amazing. It was an eye-opening experience, and sharing all my symptoms. And I was there to study. But through the classes, I was also able to treat myself, or meaning being treated by my professor there. So he gave that opportunity also as a way to understand the whole modality of Ayurveda. Mm-hmm. So he prescribed a lot of herbs, and as I understood at the time, endometriosis is not a term that we have in Ayurveda. So it's more diseases of the reproductive system for female. Yes. And that's one thing that I love about Ayurveda, that I was so passionate about, that in the US. So I was coming from the US, right? Like a very westernized world, landing to India, learning about this ancient, fascinating philosophy and medicine technique in India. And I want a name for my condition, right? And I think in the US, in the modern medicine, we tend to get a lot of diagnoses, like we want to put names into conditions. And often we don't even have treatment for the conditions.
Yeah, yeah.
And in India, in Ayurveda, I found it was the opposite. It's like, well, we don't have endometriosis as like a terminology in Ayurveda,
A particular
but
term.
we
Yeah.
understand. Say what? Say it.
Yeah, we don't have a particular terminology for endometriosis, but there are problems. The symptoms are explained well in Ayurveda. Yeah, that
Exactly.
refers to
Yes.
endometriosis. Yeah,
Yeah. So, and that's what it really hooked me to Ayurveda. It was like, but we understand the symptoms. And if we understand the symptoms, we can calm down the symptoms.
yeah,
If we also understand the imbalances, we can pacify the imbalances, we can calm down the imbalances. Then the condition is not even there to begin with, because we were able to
yeah,
bring things back to balance.
yeah.
So that to me was fascinating.
Yeah. So insert how you were managed or how you managed yourself. What used to be your routine during that period?
So during that period, 2013, I had just finished my master's degree.
Okay.
So that was actually a gift to myself. I finished my master's degree and I was like, I need to go to India,
Yeah.
because if I don't go now, I may get a really good job, and then God knows when I'd be able to. So previous to landing to India, my lifestyle was busy, because I was 3 years prior to, my to getting my master's degree, I was doing 1 year prior. I was doing my internship, I was working part-time, and I was going to school. So I was like really, really
Yes.
busy.
Yeah. Yeah.
Yeah,
So
that was in the US, in New York City.
yeah, yeah. So how was like the herbs? What were the herbs that were recommended for you, and were there any specific yogic practices that you were doing at the time, or what was the functional nutrition side that you were working on yourself? Can you put some light on?
Yeah.
Yeah.
Sure. So in India, the remedies recommended was to first specify the vata. So I was diagnosed with a vata imbalance and also pitta imbalance, and diagnosed and determined as a pitta prakriti. So I'm a one dosha prakriti. I'm pitta, a strong pitta prakriti.
Yeah.
And I, at the time, had a vata and pitta imbalance. So that was corrected. I remember taking a lot of Shukumara Rasayana
Okay.
and Kashayam, sorry,
Right.
so Shukumara Kashayam, and really good to the reproductive system. And I finished my about a month and a half of studies with Dr. Sundara Raman, and then I did a yoga teacher training at the same facility. So which was very focused to therapeutic yoga. So I brought all those modalities back home. Then I went to New York City at the time. I was still
Yeah.
living there. And I was able to practice yoga at least 3 to 4 times per week. I was eating better. Now I had the knowledge of eating according to my dosha,
Yeah. Yeah. Yeah.
and not doing practices to bring the doshas out of balance too. So then I was in a good path, no longer in school. So that was a big amount of stress that came off my shoulders.
Yeah. So after you did this, then you again recarried this knowledge to many people around you. And what were the results? Were people happy about the new approach to treat their endometriosis, also to help them to conceive?
Yes, so this is what I'm doing now. This is really new. This I'm doing for the past only 6 months,
Okay.
that I decided to really niche my nutrition practice, helping women with endometriosis. So
Okay.
this is fairly new. From 2013 all the way now to 2014. One, I was busy having a baby, that we get into that, of course, but I was helping people of various conditions. So I was helping men, women, kids, all through nutrition and lifestyle practices to bring them back to balance. I didn't feel comfortable yet. I was so new in Ayurveda. And also, I had just finished my studies. I had just graduated from the master's in 2013. So I was still very insecure to have a niche. So I wanted to kind of like see everyone and see also which area would it be more fond of. And again, being secure, I felt like I couldn't call myself an expert of anything. So I was just like seeing anyone and everyone. And I was glad to be seen then, to be helping anyone. And also for the financial purposes too, I had to be taking care of myself financially. So it was not until, as I said, 6 months that I'm now niching to seeing women only. So now I only want to see women
with endometriosis in specific.
with, yes, endometriosis, fibroids, or just wanting to increase their chances of conceiving.
Yeah. Also, Anamaria, going to the next phase of our conversation, I would love to know about the postpartum practices of Brazil. Right now, you're here, there in Brazil, and can you put some light on how women are treated after postpartum, after she delivers a baby, right in the hospital, and after when she comes back to her or her home, how she is treated with everything? Can you a little bit put light on this?
Sure, yes. And I have to say that things have changed from the time my mother gave birth to me and from the time now women are giving birth. So I could say like, for the last 40 years, my mother, she gave birth naturally, and it was not even another question. It was just the way it was done.
Yeah.
Nowadays in Brazil is really big on actually having C-section. The culture here is that you find out that you're pregnant and you go to your doctor maybe for prenatal care or as early as like 2-3 months, and you already schedule your C-section. And
Okay.
that to me is like, that is crazy. It not without judgment here, but the crazy part that I feel that I don't know if the baby is ready to be born on the day that you're scheduling. So the culture has changed for this 40 years. Before, the baby would choose and the mothers would go perhaps when the water, would break or when they felt the labor would start. Now women are scheduling. Why? Because they have very modern lives here. So women are working and they want to schedule. They want to know where they want to be. They want to plan their vacations around that. The physicians also want to plan their vacations. They also want to plan the schedule. So to me, that was a little bit alarming, especially coming from the US and now learning more about relearning more about the culture here. But back also on 40 years ago, women would give labor and their postpartum time would really be respected. So practices such as you can climb the stairs, you can carry heavy things,
Yeah.
Postpartum, you out to be, in a relaxed environment, getting like very nutritious food. So here's like a chicken bone broth is really huge for postpartum
Okay.
because it's very healing, it's very nourishing to all the taboos and, to helping to give strength back to the woman after birth as well. But nowadays, I find that it's like it doesn't have much difference. Sometimes women they have to go back as early as 2 months back to work. Well, sometimes, the postpartum, the 40 days is that what should be respected. And sometimes they don't respect that either. They go back to work very soon. So I find that the modern way of living is being lost. And again, I will be saying this in this podcast that I love the Ayurveda knowledge because it brings back all of this, right? It brings back all this knowledge and when I say brings back to us living this modern society, it brings back this old knowledge that there is a reason why we should actually respect the postpartum
So, is
time.
there anything, Anna Maria, that you have talked to your mother or your grandmother on either side about this postpartum timings, about the way you should be taking care of yourself, and how have your family members gathered for your postpartum time to really help you out? What are the practices in this time in Brazil today?
So when I had the baby, I was in the US. So it all happened there. My mother was lucky enough for my mother to come. So when my mother came, my baby was 5 days old. She wanted to come for the birth. The baby came at the right time, but it was before what the doctor had, calculated. And so she was already there, but she helped me so much, just bringing the comfort of, like a elderly person being there and helping me and giving that knowledge. So my mom cooked special foods for me. One is called canjica. That's how we say in Portuguese. And
Okay.
it's canjica,
Okay.
Canjica.
Okay. And so, can you tell a little bit more about this? What is the base material
Yes.
dish and how it is prepared?
Yeah, so canjica is corn, the grain. So you get the corn, which is actually not a grain, it's a vegetable, but when you get it like a dry form, people in Brazil tend to call it a grain, even though it's not.
Yeah, yeah.
But you get it like in a dry corn form and you soak it, usually overnight to help it to soften and to decrease the cooking time when you're ready to make it. And also it helps with digestibility too. So when you do that, as a nutritionist, I know that you're helping to really to soften the grain, or in the case, the corn, and help to digest. So it helps to
It has a lot
digest
of
better.
fibers as well. The maize grain has a lot of fibers as well.
Yes, so it
Yeah.
softens. So after those 8 hours, you discharge that water, you wash it again, and then you put in a pan and you cook with milk. So it's a very cooling and also nourishing dish. So you cook with milk and then you put a little bit of condensed milk to make it very sweet. It's said to be like a can of the commercial condensed milk. I find it to be so sweet. So my mom, she adjusts and puts a little bit less, but the recipe calls for a can. And so you cook, you bring it to boil, so after it's boil, you reduce. So you let it really like a simmer there so the corn can get even more swelling with the milk and the
Yeah.
condensed milk. And then you add cinnamon and cloves powder. So it's actually a sweet dish, it's not a savory one.
Mhm.
And then you're supposed to have hot. So it's very nourishing, it's very filling, and it's very sweet and cooling. And the cinnamon, the spices is also good for digestion and many other benefits, as
Yeah.
you also know. So it's
Yeah.
a really good dish.
Yeah. It's a traditional dish from Brazil, right?
It is a traditional dish from Brazil and is good for postpartum, and also is believed to be milk producing. So it helps the
Okay.
female to produce more milk for breastfeeding.
Yeah. Are there any practices for massage during this postpartum time, as we say, Avyanga in Ayurveda?
The old folks they used to do has lost, not as specifically, not as big as in India, nearly as big as Abhyanga. I remember my time in India that I would walk from the place where I was staying to the doctor's clinic where I was taking classes and doing my internship with him. And I would pass by in this little house, and the gate was always like semi-open, and it was a elderly woman massaging a baby that I would suspect to be, I don't know, maybe like a month, maybe not even. It was a tiny, tiny little thing. And the woman was massaging and lifting, the baby's leg and arms. And I was so curious about it. And I went to my doctor, my teacher at the time. I call him my guru as well. And I was like, what was that woman doing? It was like a Bianga for babies. And he was like, yeah. And I think there's a specific name that now I don't recall. And then I even found books about it and I was reading, so I understood more. And unfortunately, we don't have, what we are taught from grandmothers to mothers is to massage the belly, because babies, their reproductive system, their digestive system is not as well formed. So they sometimes may have more gas, especially if the moms are eating certain foods that are gas increasing. So we are taught to massage their bellies, but it doesn't go in any further than the belly.
Okay. So when you were a kid, there was also no any practices of massage.
No, I wish. No, there was no practice. It's a massage.
So do they believe in Brazil? In Brazil, do people believe that the things that you are eating, the mother is eating or having in her diet, will impact the quality of milk?
Yes, for sure. Yes, that we do.
Yeah.
Yeah.
Yeah. So is there any practices that tells that the quality of breast milk can be improved with this type of dishes or certain herbs or certain spices that are, original to Brazil?
Yes, there's a fruit in here that is called piqui.
Picky.
And picky. I personally don't like it because it has a very, very strong aroma to it. And when I eat it, I feel like I'm smelling like perfume. And
Oh,
that throws me off a little. But for example, my sister-in-law, she loves it. She goes when we go like on a road trip and she sees a tree of it, she parks her car, climbs the tree, picks the fruit
yeah.
because she loves that much. So it's very popular in here in the state where I am, not the whole Brazil, but on the state where I am and the surroundings is very popular. And you make a good dish that is from it that is actually savory. And you can eat the fruit. Got to be very careful because there's a lot of the spikes are actually inside. But
Okay.
when you cook it, it yields this beautiful, thick orange sauce, and
Mhm.
people love to eat with rice, and it helps to increase breast milk. So when women are just had a delivery, they are also instructed to have piqui.
Okay, that's beautiful. So, in like in India and Nepal, it is always advised that after you deliver a baby, you should be having warm water. The regular water has to be warm. Is there any such type of practices there?
No, in Brazil, no. Some cultures will enjoy tea more than others, and Brazil is also like a very, very hot. I've been in places, I've been in India, I think comparing like almost like a Kerala's weather, like very like of the temperature, tropical and hot. So people are not very accustomed to drink hot beverages, but coffee. Coffee is a staple here. I mean, we produce the best coffee in Brazil, so that's a staple. And it really, I feel they can have tea, but they have coffee all the time, and it's equally hot. So often I have this conversation. I was like, well, that tea is good for you. Oh, it's too hot to have tea. And I was like, but you have coffee. Oh, but coffee is different. But to answer your question, no, it's the culture we don't have as the Chinese culture and the Indians to have a warm beverage. No.
Okay. So, yeah, this is beautiful to know that when you said that the diet the mother is taking, if the mother is taking some of the vegetables or food items that produces gas, that can also impact the health of the baby. Like the baby also can be gassy, like see or he can have some colicky pain in her abdomen. So the massage is particularly on the belly part. So this is very interesting to know that because most of the time many of the the modern day care doctors, they are not really accepting the point that the um, mother nutrition will definitely help with the the vitamins, minerals and all these things, but also the gassy foods can also impact the the colon health of the baby. This is not so well accepted, but I find it very interesting that people do accept this fact there in your country. So is there any
Yes.
specific thing that, like in Brazil, the postpartum things, any specific more interesting things that you would love to share?
Yeah, so since we actually got in contact and asking more about the practices here, I came across something that I didn't know.
Yeah,
And maybe that's due to, 20 years living abroad that I spent in the US,
yeah.
that I lost a little bit of touch. So there's such a thing that is called garrafadas. So garrafadas, garrafa is a word for bottle. So bottle meaning just so garrafada would be like a bottle. So you get a big bottle, an empty bottle, and you put a lot of herbs. You stuff that bottle with herbs, and then you put some like water and I think some alcohol grain, and you let it sit
Fermentation,
there
maybe for fermentation,
for
fermentation.
yes,
Yeah.
yeah, for fermentation, yeah. And you let it sit there. And then from that mixture, you take some. So, but the medicine, the modern medicine here is a little bit like um, shying people away from doing this. And this is even prior to my mom's generation, that was a big thing. And also socioeconomic too. So people from a lower socioeconomic class, they tend to do more of that just because it's easier, is easier to be accessible to them. So that was part of the culture that I didn't know myself. So there is such a thing that is herbs that are produced. I remember in India seeing little bottles with a lot of herbs stuffed. And if you buy that way, the bottle just with the herbs, and then you put coconut oil when you're ready to use, and you let sit there for some time and you apply to your hair. That's how I learned. And the time that I went to India with my husband, that was in 2017, I remember him getting some of the bottles. So it made me to remind me of that, that putting herbs on a bottle and then putting some uh, liquid medium to help the herbs um, to get into the medium itself, and then ingesting that. But in India was for hair, but in Brazil I learned that you actually ingest internally.
Yeah, there are lots of herbs infused water that are used for drinking. Also, that is used for like the same water can be used for bathing, to take shower, and also for the massage. You put a specific oil. The oil is prepared with different sorts of herbal decoctions. This is a different. But can you really explain me like what sort of herbs are put in those bottles there?
I wish I had done more research. I don't know as well, and I'm not well versed to some of the herbs here, the local herbs. So I read through them, but I'm into really finding out like the specific qualities of the herbs, like in Ayurveda, are they hot, cooling, heavy, light,
Right.
or good for digestion, good for that. But reading, I not being well versed, I couldn't, it would have taken me a little bit longer to do a research on that. But it's probably along those lines to help to improve digestion, to improve milk
Yeah,
production, to decrease inflammation, to promote healing.
but it means that in Brazil, there is still some portion of communities, they are practicing these traditional things.
Yes, you
Yeah.
still can find, yes.
So going a little bit to the functional dietetics, functional nutrition, can you say something more about it and how you are applying it specific to the patients of endometriosis?
Yes. So endometriosis is a multifactorial condition. So there is inflammatory, there's an inflammatory factor, there's a genetic factor, there is immune factor, there is hormonal factor, there's lifestyle practices factor. So when female clients come to me, I tell them firsthand that I'm not here to treat endometriosis. I'm not even a physician for that. I'm here to help you to open up for healing. I'm here to, it's kind of like a garden. I make this analogy. You
Yeah.
know, if you try to plant a flower or a plant in a garden that the soil is poor or destroyed or full of chemicals, nothing's going to yield from that. But if you treat the soil first and you plant something, something will flourish. So I tell them, I want to flourish you. I want to help you to flourish yourself. So
Yeah.
let's take a look in all those factors. So if it is a hormonal factor, let's see what's causing that hormonal imbalance. So I'm a functional nutritionist because I done training to be well versed in labs. So when you go for labs and you have a set of labs, I can really identify through like flags if there's like inflammation, oxidative stress, acidity, like think what's going on. So when I have labs in front of me, and of course I do that on the back of my mind, the whole Ayurvedic tongue analysis I often do, even though that I do online. I tell them to send a picture of their tongue, so I do that diagnosis too. So I collect all those information and I help them to improve their digestion. So as I mentioned, endometriosis is an inflammatory condition. Often that inflammation roots back to your digestive system. So I always take a look on your digestion, not only how well you are eating, but digesting and also excreting. You know, often I work with clients, they go to the bathroom every other day, sometimes 3 times per week. You know, they building up toxins, they building up ama. So I help also to release that. So is a dress for females, but is also going to the root cause. And with endometriosis, we get with the modern way of living a lot of, unfortunately, we are poisoned by our
On
cleaning
diet.
products, by our
Yeah. On diet. And also there are environmental toxins that are coming in contact,
exactly,
right? So that
yeah.
means that you are practicing more of like, the Ayurvedic khichdi or some of the specific Ayurveda diets for your clients there also.
Khichdi is very foreign to them, so I try to use to still be foods that will pacify their doshas, but they are accustomed to. Because if you go to foreigner to them, they may feel like, oh, that's not for me, so I don't want them to shy away. Often I introduce some like a in the khichdi style, but we don't have mundal in here in Brazil. We
Okay.
have the bean form before split it and taking the shell off,
Okay.
the green gram, right? Am I
Okay.
saying it right?
Yeah, good. Good.
So often I use that and I teach them how to do khichdi, but it's more like balancing according to their dosha.
Mhm.
Um, and yes, I wish we would have a mundal and I would be making
Available
more
in Brazil.
khichdi.
So, Anamaria, I think we are like in the very last segment of our talk. We have very few minutes left. So, how you conclude your overall practice of 6 months, incorporating your functional nutrition and all those, and also the principles of Ayurveda, how it is helping you and your clients.
Well, it has helped me tremendously. I was able to conceive even having endometriosis and being told by physicians that I wouldn't probably not be able to be a mom. So, and going through the journey myself, I'm helping other women too and encouraging them that there is a possibility and believing that. And if there's no possibility, to look in other means, but to be well informed. With endometriosis, the medium time to find out that you have the condition is 12 years. So I want to actually lessen the gap. I want women to be aware of that and find out maybe in 1, 2 years so they have bigger chances of conceiving. Because for a lot of women, if you wait 12 years, you may actually pass that age of being able to conceive.
Yeah, right. And Maria, thank you so much for joining the Vedic channel, the Vedic couple channel, and sharing such interesting facts and some of the traditions that are practiced in Brazil, and the work you are doing is very commendable. I wish you again come back to Nepal and India, and again we can share so much of knowledge sitting face to face. And thank you so much for your time. I hope we will again reconnect and make it some few more episodes on this.
Thank you, Subhadra. Thank you so
Thank,
much. I
thanks.
appreciate it.
Namaste.
Yes, and I hope to come back. And I love Nepal, being to Nepal and India. So anytime I may take your invitation very seriously because
Yeah,
I love traveling and going to there.
yeah, you have to. Thank you so much. Namaste.
My pleasure. Namaste.